Today I'm going to talk about Frontosphenoidal Craniosynostosis. Now I know it's a very difficult term and it is quite rare as well, in addition to the word being very difficult to pronounce. Now what is Frontosphenoidal Craniosynostosis? Frontosphenoidal suture is the suture, that is the growth plate in the skull between the frontal bone and the sphenoidal bone. Now the frontal bone is the bone of your forehead and the sphenoidal bone is the bone in your eye. So there is a growth plate in between these two bones. It is called as a frontosphenoidal suture. This is categorized under one of the minor sutures in the skull. Now, if this suture fuses before it usually should fuse, then it can cause eye deformities and skull deformities which look very similar to unicoronal craniosynostosis or the anterior plagiocephaly. Although it looks very similar, when we do a CT scan we find out that the coronal suture is absolutely normal, and it is very difficult to actually find out that the frontosphenoidal suture is fused. It takes an extremely expert radiologist to find it, or somebody who has been practicing craniosynostosis for a long time to diagnose the condition. Now the treatment is very similar to other craniosynostosis. If a baby comes to us before 6 months, we do an endoscopic strip craniotomy of the frontosphenoidal craniosynostosis followed by a helmet therapy. If not, if the child comes later, then at 9 months we usually do a fronto-orbital advancement surgery.